Hi there. I just wanted to make a video sort of talking about the cognitive behavioral therapy that I've been in since January of this year. So I did make a video in the past about my experiences with CBT, cognitive behavioral therapy, when I was seeing a different doctor in town, and that was not a positive experience. However, I think the key for me is really finding a good doctor, someone who specializes in anxiety and panic attacks, and you know, whatever your particular diagnosis is, and then, you know, maybe working with that person, or maybe doing a little bit of doctor shopping. So anyways, I've touched upon my issues in the past here, and especially on the weekend vlogs, but if anyone's new, maybe this is the first time you're watching anything on my channel. Since I was 18, I've had issues with panic attacks with agoraphobia. So basically like fear of leaving my apartment or leaving my safe space, which is usually, like, in college it was my dorm, now it's my apartment. And basically having a very, very restricted area where I feel comfortable. And a lot of things are fearful for me, like going into an enclosed space, and a lot of situations can feel that way to me, especially with other people around. When other people are nearby me, I feel like the threat or risk level is elevated, so I tend to do most things alone by myself. Yeah, and then I've also had issues with depression, but I feel like I mostly have a good handle on that, and I've had that issue since I was a teenager. So in terms of the cognitive behavioral therapy that I'm in, it's to treat the panic attacks with agoraphobia. So now that you know that, the guy that I see, his name is Dr. Michael Bailey. He runs the anxiety and panic attack clinic of Santa Barbara. He is pricey. He does not accept insurance, and I think that's maybe something that happens with doctors who have a wonderful reputation and do good work, and they've been in the community for a long time. Maybe they decide to not accept insurance because they just want to get a full payment up front. I'm not exactly sure what the deal is with that, but for me, the financial cost definitely kept me away for a while. But I can say it's been completely worth it for me to invest in that, into the therapy for myself. So yeah, so I started seeing the doctor in January, and at first he wanted to see me every week. For about 1 hour, sometimes less than 1 hour, and I just kind of told him about my fears and my history. You know, that's the initial intake appointment. And then he taught me about slow, deep breathing, where you breathe in for 4, you hold for 4, the count of 4, and then you exhale for the count of 4. And he kind of explained about how sometimes people, you know, like you get tingly fingers and stuff like that when you're anxious, because it's like you're getting too much carbon oxide or giving out too much carbon oxide. I don't know. He went into the science part, and I was like, I don't know what you're saying here, but okay. And we've just made progress gradually. That's really the key, is to do gradual progress. First, we started with imaginal exposure, where you imagine yourself in a feared situation, and you do it every day for different amounts of time. I'd imagine myself trapped somewhere and not able to leave, and just something kind of scary. So for the first about 2 weeks, I think it was all imaginal. So I'd come home from work, and you know, you're kind of tired from being at work all day, but you got to do your assignment or your homework. And I just imagined myself in this feared situation, and then eventually it wasn't as scary to think about. And sometimes actually your mind would wander. That ends up being an issue. Your mind's like bored and tired of it, and like, whatever, I've been thinking about this a long time, and your mind wanders, and then you're like, wait, no, I need to stay on topic, I need to stay focused. And then we gradually started to do more actual exposure therapy, like where you're out in the world. So for me, we transitioned that into driving to and from work and having these feared thoughts while driving. And that's something that I feel has really, really improved for me. And that's the most notable difference, is that I can drive places, particularly to and from work, without anxiety, or with very low degrees of anxiety. So it is uncomfortable when you do it, and you get nervous, and you're kind of scared, and then sometimes you know, it's just hard and you don't want to do it and you're all sweaty and you're like, oh, something bad's gonna happen. But you end up getting through those situations and seeing everything's okay. Nothing awful happened. This feared situation didn't happen, or if something did happen, I'm able to deal with it and to handle it, and I don't really have anything to be scared of. So there's this switch with your thinking where you're like, well, I guess this is okay now. It's okay. It's not scary to drive into work or to drive home from work. I don't need to get all worked up about it. And then we've been working kind of in a like hierarchical levels, you know, in terms of the least scary things to like right now the medium-ish level stuff. The top scary stuff to me are situations you can't practice easily, because for me that's flying or being in a train or in a bus and in these like really contained situations. And I did panic in a bus in the past, so, but I haven't really gone in a train or plane in years. So anyways, it's kind of hard to practice some of those higher level things that aren't very practical. But the other lower level things like going to restaurants or going to the movies and just not feeling, you know, feeling like I can't really easily escape, and trying to do things with other people, that's kind of what we're working on right now. And it's been going well. So yeah, we first started with the imaginal exposure, and then gradually working that kind of forced negative thinking, that's what we call it, is forced negative thinking about your worst case scenarios, into situations where you're out and about and you're doing things that might cause a little bit of anxiety for you, like waiting in line at a grocery store. So you do that negative thinking while you're in that situation. And yeah, sometimes I have like started to feel like kind of panicky and sweaty, and I'm like, get me out of here. And I may step outside and then go back inside to the situation. You know, it's not always super duper positive. Sometimes you have a situation like at a coffee shop where I got really panicky and sick to my stomach and had to use the bathroom, and then I was scared of going back. And I didn't go back for about 2 or 3 days. Which for me is unusual because I usually get coffee every day. I like my vanilla lattes. So, you know, the key is don't let that fear completely stop you from doing things. You have to go back and you have to face that fear and you have to conquer it and turn it into a new positive memory or positive association. So I ended up going back to that coffee shop, and you know, I was pretty nervous about it, to be quite honest. And the first, like, even the first week after that, like, I just wasn't totally comfortable. But you just keep going back, you face that fear, you do that forced negative thinking, and eventually you kind of chill out and mellow out a bit, and it becomes easier. So that is something important, is, you know, if you have something that maybe doesn't go so well, or you freak out or something, you gotta go back. You have to go back. You can't let that ruin you or rule the rest of your life. So that's what I've been working on, is going back into these like fearful situations, like this nail salon thing. Oh my God, of all the things in the world, this became a big deal. So I went into the, you know, started seeing this doctor in January, and in the beginning of February, I thought, you know what, this therapy stuff's going so well, I'm gonna go get my nails done. And I was like feeling very confident and full of myself. And I went to the nail salon, and about 10 to 15 minutes in, I just started to panic, and my mind was wandering and thinking about things, and I felt trapped and stuck. And there was a woman next to me, and she was getting her nails done, and I had never been there. I didn't know the nail tech. There were all these people downstairs getting their hair done. You know, I just was like, ah! I felt kind of like the walls are closing in and I'm stuck and I can't leave and I'm trapped. And that's where my mind was going. So I ended up leaving that salon and then just crying and feeling really, really bad about it and upset. And ever since then, I've been working with my doctor on going back to the nail salon. And I've been supporting their business. So I've been working on going back to the nail salon, having that forced negative thinking of I'm trapped, I'm stuck, I can't leave, and being okay with that, which is still a challenge for me. The last time I went was this past Sunday, yeah, for pedicure. I got quite nervous, and I was, you know, I just wanted to go. I was looking at the door. I wanted to get the heck out of there, but I was like, I know I can't, and I didn't want to take Xanax because I had done that previously, and I know the doctor really wants me to just face these fears on my own without medication. So that's still ongoing for me, but the important thing is that I keep going back as often as I can. About every 2 weeks or so is what I'm aiming for, and to not be afraid of it anymore, to not be afraid of that situation, and to know that I'll be okay. And you know, even if I do get uncomfortable or panicky or sweaty or my legs get all tingly, I'll be okay. So yeah, it's I feel like this therapy has made a really big difference so far. It's just been about 5 months now, and I'm already I mean, I still have a lot of things I need to work on, excuse me, which takes time. You can't expect results right away, you know, especially if you've had these issues for like 12 or 13 years plus. It's not going to go away in a couple months. You need to work at it continually and ongoing, and to kind of work on proving all those fears is wrong, or maybe not so true. Anyways, I can just tell a big difference, and right now the biggest difference is on the weekends. Lately I've been going out more, like the last 2 or 3 weekends, and I just feel a lot happier about it, and I look forward to the weekends now. I mean, in the past I'd look forward to it, but that's only because I could sleep in and be at home and play with the cats and stuff. Now I look forward to it because I can go out and do things and maybe socialize and meet people and do stuff with friends. I don't have that many friends. Probably not a big surprise, but that many close friends. Yeah, so that's the biggest difference, is that I noticed that I feel like happier and more excited about the weekends and doing neat things. So that's a really big difference. And right now the doctor, when I saw him just on Thursday, he said, well, let's just focus on improving your like quality of life right now on the weekends in the Santa Barbara area. So that's what we're focusing on right now, as opposed to focusing so much on the plane thing, because that's like kind of far away. I mean, I do want to fly up to see my sister at some point, but yeah, we're just focusing on the local area, getting more comfortable going out and doing things with people. And then what I need to focus on now is having other people in the car with me, because when other people are with me, it just, in my mind, I just imagine all the things that could go wrong, the ways I could embarrass myself, or you know, someone might think I'm weird or strange. And yeah, so I need to start working more on driving with other people and kind of doing things more so with other people. For me, my weekends end up getting pretty busy, well, busier, and sometimes kind of unpleasant, because that's when I do those feared situations, and it can be uncomfortable. And sometimes you don't want to do that. You know, you've been at work all week, you just want to chill out and do nothing on the weekends, but instead, you know, you're doing these things that kind of scare you or freak you out a bit on the weekends. But that's when I have most of my free time and can do these things. So you know, it's a bit of a commitment, definitely a commitment, and it can be uncomfortable and make you, you know, real nervous, and you don't want to do it, but you just got to do it for yourself to get better and to change your life. So anyways, that's my little update, and maybe in a few months or so, if anyone wants to see another update after, you know, a significant amount of time, or some bit of time, then I could film something else. So if you have any questions, please feel free to leave them below, and I'd be happy to answer. All right, thanks for watching. Bye.